Hello, Assalamu alaikum. Today we learn about the cranial fossa. There are three cranial fossa: anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. First of all, we know about the anatomy of the cranial fossa. Anterior cranial fossa is separated from the middle cranial fossa by lesser wing of the sphenoid. After that, the middle cranial fossa is separated from the posterior cranial fossa by petrous part of the temporal bone. Now we must know about the structure in the cranial fossa. Most important structure in anterior cranial fossa is cribriform plate, which form of ethmoid bone, which pass the olfactory nerve. Then middle cranial fossa is most important. There are six foramina in middle cranial fossa. Optic canal, which is present in lesser wing of sphenoid, transmit the optic nerve and ophthalmic artery. And after that, superior orbital fissure, which is between lesser wing and the greater wing of the sphenoid, which pass the lacrimal nerve, frontal nerve, trochlear, oculomotor, nasociliary, and abducent, and with a superior ophthalmic wing. Now, foramina rotundum present in greater wing of the sphenoid, which pass the maxillary division of the trigeminal. After that, foramina oval, which is also part of the greater wing of the sphenoid, pass the mandibular division of the trigeminal nerve and lesser petrosal nerve. After that, foramina spinosum, which is present in greater wing of sphenoid, past the middle meningeal artery, which is a branch of maxillary artery. Foramina lacerum present between the petrous part of the temporal bone and sphenoid, which pass the internal carotid artery. After that, posterior cranial fossa, okay, and has a foramina magnum, which is occipital part. Pass the medulla oblongata, spinal part of the accessory nerve, and right and left vertebral artery. After that, hypoglossal canal means which pass the hypoglossal nerve. After the jugular foramina, which pass the glossopharyngeal vagus accessory nerve, sigmoid sinus, become internal jugular vein. Now, internal acoustic meatus present in petrous part of the temporal bone, which pass the vestibular nerve and the facial nerve. It's all about the cranial fossa. This is important for the examination and for FCPS exam. It is most important exam, most important point.